Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I am joined by Dr. Aline Pedroso. Thank you so much for joining me today.
Hi, Rosa. Thank you so much for inviting me. It's a pleasure to join you today.
Dr. Aline is a clinician and cardiovascular researcher at the Yale School of Medicine, whose journey began in Brazil, where she earned her PhD studying how we prevent heart disease and get proven therapies to the patients who need them. Now, her work spans AI, digital health, wearables, and electronic health record data, all aimed at one mission: closing the gap between what's possible in healthcare and what patients actually experience. If you've ever wondered whether all this health data and shiny new technology is truly making care easier, smarter, and more equitable, this conversation is for you. So, Dr. Alini, thank you so much for telling me how to say your name early.
Yes, you say it perfectly.
Good. Alini, you trained as a clinician in Brazil before moving into Yale. How did seeing patients firsthand shape the questions you now ask as a researcher? And what did that international perspective teach you about gaps in care?
Thank you. That's a great question. So, I've worked as a clinician for 5 years, and I had the opportunity to deal with many different types of patients. But I had always a curiosity beyond what I could do for one patient, and that's why it drove me to research and doing epidemiology and focusing on populational health. And the opportunity to come to the United States and see how digital health can help patients really kind of made me context the clinical practice with the research. When I say this, it's because digital health technologies right now, they bring such a benefit for countries that are developed like the United States. But the delta of improvement in countries like Brazil is much better. You can see much more because when you start from below, and you can achieve so much more with simple technologies, you can see a bigger improvement with a smaller investment. I come from a very small town, and getting technology there it's difficult, but the type of work that we do that's focused on translation to diverse populations and reaching those who need the most could show me that how we can apply these new technologies to every possible setting. So this is something that really drove me to come to the United States and work at the cardiovascular data science lab.
And your recent publications in JAMA and in the Yale School of Medicine's newsletter where I found you, you've said many patients are still diagnosed too late or never receive their recommended treatments despite all the data that we have. So where do you see that breakdown happening most, and what role can nurses play to catch that?
Yes, we are in a moment of shift, right? I feel like there is so much more data available. Patients are collecting their own data. Every health system has a system that has all this stored data that can be used to inform care. And it is sometimes complicated to these data to reach the clinicians so they can inform care. And I think like in this study, we show this gap where more patients every day are using wearable devices and other technologies that collect their health data. And when we use this smartwatch, we believe that just because I'm wearing it, I'm more healthy, I'm healthier, I'm making a difference. But there are many steps for this data to inform care, for these tools to achieve their promise as digital health tools. One of these is getting this data to the clinician so it can inform care. And this pathway it includes not only the person owning a device, but also they using the device consistently. So it collects the baseline data that we need to establish their health status. So we can see when there is like a change in that baseline. It also involves making sure that what is important about this data reaches the clinician. I think the health system is set up in a way that we are used to having intermittent data from the patients. It's only in an encounter where you collect that data at that point. And when you think about digital health tools that are collecting longitudinal data, It's like a sea of data being collected all the time, every day. How do we make sure we don't inundate doctors, nurses, and all the other clinicians with all this data that they don't really know what it means? So the data has to be collected, so patients have to make sure they use the device. And data has to be managed in a way that it gets to the clinician in a way that it's interpretable and getting for clinical care.
Right. And I think something like establishing that baseline of where you're at day to day is so important for people to appreciate as a concept. So I have worked with a lot of people after they've had a stroke to learn about blood pressure. And a lot of the time they didn't even know they had high blood pressure before they went and had a stroke. And so it's a new thing for them. And so we'll talk about the importance of taking your blood pressure at home and it may have been really high when they were in a hospital, obviously, after an acute event, and then we'll need to see where their normal level is at. But just seeing it at a follow up appointment a week or two or months later doesn't really show you what it's like day to day. They might have white coat syndrome where it just spikes because they're nervous or stressed out about being in the office. Whereas if they have a record of what their day to day is at home, then that lets you know about the wear and tear that's happening on their body every day from those stressors. Just like I think it's kind of easier to think of the glucose monitors that people wear because they're used to seeing those spikes and drops instead of just relying on a hemoglobin A1C of a one time snapshot of this is how it was the last 3 months. But I know personally, like from my family who have used it, it's shown them the difference in eating something that might be the same calories, but it has a different effect on their spikes and drops and whether or not, they're creating more insulin resistance or not. So, yeah, and I just got this Apple Watch and it was saying it needs like 30 whole days of sleep data on me before it can start telling me what those trends mean about my quality of
Exactly.
sleep. So I'm just counting down the days now. When do I get to learn something?
Getting used to sleeping with the watch and all.
Right? Exactly.
Yes,
It's more cumbersome than when I had one of the rings or something like that, but it helps
exactly.
me that it lights up and tells me
It
it's
gives you so much information. I mean, it's such a small device that has so much technology in it. There are so
Mhm.
many sensors, different types of sensors, collecting many different measures on your physiology. And what I think what you're trying to say and what you're saying is about empowering patients. Because
Yeah.
patients have to understand that when you have a device, it's not that the the idea with the device is to wear it couple of times during the day or only when I'm working out or only when I'm doing this. When patients do that, they're not establishing the baseline. So we'll never know if that it's abnormal or not because we don't have an idea of what is normal for that patient. And that understanding that this device is working this way is also important for the patients. And that's on the consumer side.
I see.
There are other variables on the data side and then on the health system side. So all of these three like major steps have to be considered when we think about the new generation of digital health.
Yeah. So, wearables and patient generated data are everywhere now, as we said, from smartwatches to even home blood pressure cuffs, which are more of that incidental reading
Yes.
instead of constant. But what separates a gadget that just collects numbers from a tool that actually changes outcomes for cardiovascular patients? What have you seen?
I believe that a tool that is capable of changing outcomes, changing cardiovascular care, is a tool that is connected between the patient and the care that the patient receives. So when we think about having an Apple Watch, let's simplify as that. Having an Apple Watch, the data is being collected, it's all in the cloud,
Mhm.
and what do we do with this data, right? We need systems that are interoperable that can ingest that data. Right now, we use a lot of AI to simplify that data. We can have a graph of spikes or a graph of longitudinal changes and during weeks, months, years. So managing this data And then we need health systems that care about this data, right? We need reimbursement systems. We need dashboards that simplify the data and gives you what you actually need. And what we saw in this study, one of the things that we studied was what are the digital divide questions that are preventing patients from willing to share their data from and to actually share the data. So is it that the patient don't know how to use the device, or is it that they don't have the internet connection or the infrastructure to use that device fully and then share the data? And we saw that there are some digital literacy questions about preventing people from willing to share. And we saw that access to internet and having a good connection, having the infrastructure is not even associated with willing or actually sharing the data. So we see that it's not that the patient doesn't want to share the data, is that they don't have a way to do that. The health system is not ready to receive it.
Or
And
maybe it's not user friendly.
yes,
I know there's ways I've tried to, attach different devices I've been wearing to like my health system in order to do that. And I would consider myself to be digitally literate. I'm out here using the internet every day and multiple devices. But then just logging in, do you know what seems to get in my way a lot? I keep forgetting my password.
password. I was going to say that. I was going to say that. That is a big bottleneck.
Because like my Apple device will use my face and I don't have to remember my
And
password.
nobody knows any passwords anymore. Everything is already saved on every device that I own. I don't remember any passwords. This
And
is
we
a big bottleneck.
them all the
Yeah,
time.
all the time they ask for new ones, and these are we are young people, and most of the people who could benefit the most from these are older people who have even a harder time dealing with these things. So yes, accessibility, having a user-friendly portal, it all influences how patients can do that. And I feel like on the over the past decade, the investment has been on making sure that there is more digital literacy, like that everybody has broadband connection, that people can have access to internet, can have a device and all those things. And right now it's shifting to the health system. Unrelated to this study, well, I'm going to present at the next AHA conference another study on the other side, showing that those health systems who are investing on these interoperable systems that can use outside data or data generated by patients to inform care, they have better cardiovascular outcomes. So this is already a sign that hospitals that are investing in digital technologies, and more than that, hospitals that are investing in using the data that it's outside the health system to inform the health system care, they are having better results. And maybe that is a way to, with little investment, right? Because the data is already there, you can have bigger gains in the health system.
Yes. And, I think a central theme of your work has been making sure that AI benefit is getting to more diverse populations rather than widening disparities in that people who can afford an Apple Watch can have the access to this, but people who can't don't. And so, what does rigorous, equitable evaluation of these tools look like in practice? And what red flags should frontline clinicians watch out for that might be creating more disparities?
Exactly. So, as I keep saying about the health system, we cannot forget that if the patients don't have the device, there is no data being generated, of course. And when we think about investments in devices, I'm gonna contextualize a little bit about Brazil. It's not like in Brazil people have Apple Watches. Not many people have. There is a big disparity. People who have an Apple Watch, they're gonna be in the higher society. They're not gonna be those probably who need the most cardiovascular care. But there are other devices, right, beyond just those wearables. So we work a lot with portable ECG devices. That one single portable ECG device can be used in a primary care clinic for hundreds of patients. So this is a form of remote patient monitoring and affordable devices that can serve a full community and not just the individual. And I think that in terms of research, when you think about research, there is a lot of investment from companies like Apple and others that give devices so we can collect the data and we can create this information, we can generate this evidence. But when we think about actual care, there should be also an investment from the governments in making sure that if these tools can really inform care, if these tools can improve monitoring of patients dealing with cardiovascular diseases or patients to prevent a cardiovascular disease and all of those things, this can be a good investment for the government to provide devices to patients.
So, what's a good affordable type of device that works well for patients who may not be able to afford the flashiest new thing that will still provide them with this value in getting their own information?
So there are devices that are not consumer based, like not that you can go to a store and buy. There are healthcare based devices that are provided to patients. And there are devices that are consumer based that are simpler, like the bands and like other less, like not Apple Watch based smartwatches that can be like a form of investment, maybe not for all the patients, but in terms of maybe getting from government provided devices or even to be included in their insurance can be something that insurance can cover if it's a device that can improve healthcare. And I think most of the government investments are not in prevention. It's the shiny new hospital, the shiny new equipment. But when we think about prevention, small investments can make such a big difference when we think about population health. So
And
thinking about prevention.
incentives for people to use them, right? Like my husband's insurance incentivizes him to wear his tracker and to go to the gym. Like if he logs on or when he, what is the word? When he signs in at the
Mhm,
YMCA, like
mhm.
he's got it set up to notify his insurance. So he gets like a little, I don't know, an Amazon gift card, or he gets to choose what his gift card is, right?
That's
After
great.
so many times of going, and he goes 6 days a week, so he's trying to max that out. But, yeah, I think personal incentives, not just incentives for health systems from insurance companies and things like that can
I
really make
do
a big
believe
difference.
I do believe that. I do believe in investing in prevention. When we incentivize like the health insurance, giving the incentive of he- uh, being healthy, doing practicing physical activity, eating healthier, going to the gym, these are small incentives that down the line they make the biggest impact. They make the biggest difference for the health, and not waiting for the patient to be in the health system and needing that care after there is nothing that the prevention doesn't work anymore. I think investing in, even if it's just like a text message, if it's just an like an app that's going to give you a notification that you should do this or that. I don't know. For me, for example, whenever I can close all my rings on my activity tracker, I feel so accomplished, right? It gives me like a self incentive that I'm doing the right thing. And one thing that we saw in this study is that one of the things that on doing literature review, one of the things that makes like and gives an incentive to patients to use their wearable device is knowing that that data is going to be used for something. So when they know that their blood pressure monitor is going to be reviewed by their healthcare provider, or they have a primary care provider that is receiving some kind of information from a device or from something that they log in, they have an incentive to do that more. So knowing that the data is going to be used is one of the things that makes that patients get more engaged with the health device.
Exactly. We can't just, like, ask for blind compliance with nothing to show for it, right?
Exactly, exactly.
Well,
Patients want to see something in return, right? Making sure that they're doing all that the effort in return for something like that's going to be used, that's going to be good for me.
exactly. So, this brings me to the $1,000,000,000 question that I ask every guest on the Nurse Rosa's Insights podcast. which is, Aline, if you were given a grant for $1 billion to meet a need you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
Oh, that's a great question. And it's a tough question to ask. Having the money to make change gives opens so many doors, like so many opportunities. What should we do? But I think thinking about my own research and the things that I focused the most in my work, I would think about an end-to-end system where we use the data to first train AI models that are able to detect disease, and then we use this data, same data that is collected, to be informing health decisions in the health system. And one thing that we do a lot is trying to find the most diverse use for all the models we create. So if we create a model that detects heart failure, how is the best way that we can use this for many use cases? So we can use it to prognosticate disease. We can use it to risk stratify patients. We can use to triage patients. And I think the end-to-end strategy would be from data collection to health system integration, and how this data can return to doctors the information that they need. One example is a study that we did that we used an AI model applied to ECGs, which is the most available health cardiovascular data available in healthcare. And we use it to triage patients who need to receive an echocardiography in Brazil. So in Brazil, there are wait lines that are very, very long, and all of those patients need to receive an echocardiography. But sometimes the patient who needs it the most is going to wait in line for 6 months. So when we use this AI model that is not even created for that, but can be used to triage patients, we apply the technology that is so broad to something specific, and then we can make sure that that patient who needs it the most is going to get the echo first, is going to be receiving the treatment that they need in a timely manner. So those new technologies that we create here in the United States can benefit many populations that are unrelated to what we do here right now, but there are so many applicabilities. So when we think about this, I feel like it's about creating something that can be globally applied, that is generalizable to everybody, that can create the most impact in terms of number of patients who can benefit from.
It is so beautiful. I absolutely love that you are doing this research on something that can be applied really right away. And
Yes,
because there's so much of the time research is done that makes a discovery and it takes 13 to 17 years to get it out into the real world. But you're talking about, devices that exist right now and processes that can be put in place to change people's lives this year, not just really in the future. So thank you so much for the work
exactly.
that you're doing in
I
this.
think it's a privilege because many people, as you said, spend years and years doing research, and maybe just new, like the next generations will be able to benefit from that. And it's a privilege for us to do something that can create change. It can change the health system, can change health of patients right away. And it is really, I mean, it gives us more incentive to keep doing this kind of work.
Definitely. So, for our listeners, if anyone is listening to this and would like to discuss it more with you further, is LinkedIn the best way to find you?
Yes, please, you can message me on LinkedIn. I'm very active over there.
Yes, you are. And I will put your LinkedIn in the show notes. And then for our listeners, if you've enjoyed this episode of the Nurse Rosa's Insights podcast, please be sure to like and subscribe wherever you are listening or if you're watching on YouTube. And be sure to connect with me on social media at Nurse Rosa Speaks. I'm on all the platforms that way. I'm also on LinkedIn, so I'll put that in there next to Dr. Pedroso's as well. And let me know if you have any ideas on what might be preventing people other than forgetting their passwords from participating in sharing their data for their own health, right? Because I think that's an important bottleneck for us to find out what is the causality so that we can address it and empower more people to connect with healthcare professionals who can help them make sense of their own health data. So there's an idea for the future. And I'll see you in the next episode.